25 years is really an achievement considering that in that period we were able to build a continuum of services.
We started as an AIDS service organization, primarily serving Asian gay men who often were isolated, and we added medical services and care coordination and support and mental health and all of the important things that population that we were serving needed.
There's much to celebrate, but also much to look forward to, because I'm really looking forward to an Apicha that has been built over the years on very solid foundation of mission to immigrants of limited English proficiency, to the people living with HIV/AIDS, and to the LGBT community that has carried the brunt of HIV on its shoulders, and now being able to bring the services that we have developed to a community that is really in need of not just access to care, but the quality of care that we are able to produce.
Before coming to Apicha, I very much didn't feel in charge of directing my healthcare. Definitely never felt that I could really bring up that many things around like gender dysphoria with my provider. I actually tried to access transition services a little bit before approaching Apicha and was told that I would have to be on a waiting list. I was pretty worried at the time because I knew that I needed to start as soon as possible.
The previous clinic that I was receiving care at, it was like a factory. They would just see me, push me out. I never really thought about HIV during my life, only when I was actually at the doctor's office, and that's when I was the most sad. I remember the times that they used to draw blood for me and I would just cry, and I don't think any of the nurses or the staff there were prepared to handle that kind of emotional distress.
I feel like a lot of times other doctors or other clinics either have a sense of judgment on your personal life and your sexual behaviors that creates a relationship that's not really honest.
Algo importante que no lo hay en otras clínicas donde he estado es que las veces que he venido a Apicha y me han atendido, en ocasiones no he tenido para pagar mi consulta. Sin embargo, ellos me han atendido y me han dicho, en tu próxima consulta puedes cancelarlo o en una próxima ocasión lo vas a cancelar, pero me dicen, no dejes de venir a tus consultas. Se preocupan por mi bienestar.
Upon reaching out to Apicha, they set up an orientation appointment for the next week, and I came in and counselors guided me through all of the initial steps, and since then have continued guiding me in my healthcare.
The first time I walked into Apicha, it was a great experience. From the friendly faces at the front desk, Dr. Moriyama talking me through my results. I never got that kind of education from my previous healthcare provider. There are just so many services here that have made a powerful impact in my life.
Cuando conocí a Apicha no tenía seguro, no lo tengo. Apicha me abrió las puertas de su clínica, me ha atendido en diferentes ocasiones, tenga o no tenga dinero para pagar mi consulta. Las personas son muy amables, puesto de que muchos hablan inglés, también hay personas que hablan español y he requerido traductores para mis diferentes consultas cuando el doctor no habla español.
I've had a wide array of services at Apicha. I've gone from ear irrigation to going on PrEP. So I would say that it's really great that I have this environment where I can talk about anything from general health to sexual health. Dr. Ting handles all of those with the same amount of ease and comfort, and I really appreciate that.
I believe that a community health center has its own functions. It's really separate from a health center. Usually, people come to a health center when they are sick, right? But a community center is a place where people want to build community, where they want to be with people who they're comfortable with, who they're safe to be with.
A lot of my community, queer people of color, come to Apicha.
Mis amigos, algunos latinos y otros americanos, han decidido cambiarse a Apicha porque por la comodidad, por las personas, la atención.
It all very much felt like a community of people that like all knew each other and were all transitioning at the time. And as time went on, I started recognizing more and more people that were accessing Apicha services and realized how like interconnected I actually was.
One part of our ability to survive has always been to be innovative. When you look at our population, they're always at the periphery of society. And many times, you really have to go at the edges in order to bring them in. The dream is to co-locate this brand of medical and support services with an LGBT center. Come and be part of the process of this dream of putting together a community health center co-located with an LGBT center. Hopefully first in Jackson Heights, but then maybe later in other communities that might need us.